Welcome back to Meds Made Easy. My name is Tarun. Today we're going to talk about Sildenafil, also known as Viagra. It is used for erectile dysfunction, and I'm actually going to talk about what else it's used for. It's also used for PAD, pulmonary arterial hypertension, and that brand name of the drug goes by, I might butcher this, I think it's called Revatio or Revatio, one of the two. But so it can be used for both things, right? And I'm going to talk about both here. Let's see here. Dosing strategies are a little bit different with Sildenafil. If you've ever taken it, you generally take it about an hour before sexual activity. If you use it for pulmonary arterial hypertension, then you're generally going to take it about twice a day. But you take lower doses of it. You don't take it at the same doses that you would take it for erectile dysfunction. So how does this medication work? It works by, I won't use a cheesy analogy, but if you've ever seen those Fast and Furious movies and they're driving the car real fast and they hit that button and this thing's called nitric oxide, goes into the gas tank, makes the car zoom by real quick. That's what it is. It releases nitric oxide in your body, and what that does is it helps relax your muscles. Now you're probably thinking, well, I'm trying to get an erection. How does relaxing my muscles help? By relaxing your muscles in the penis, blood is able to enter, and that's how, when your penis engorges with blood, that's when you have yourself an erection, right? That's when everything expands. But if your vessels won't expand, blood can't get in there, hence why you don't get an erection. So that's what we're trying to do there. But then at the same time, for pulmonary arterial hypertension, which is the blood vessels in your lungs have problems expanding, this medication is great for that because it forces them open, it kind of just blows them open with that nitric oxide. And that's how we're able to get that going. And PAD is a degenerative disease, so it tends to get worse and worse over time. So you need these medications that just kind of have this crazy effect, like Sildenafil does, where it just blows open your vessels and blood is able to shoot right through it. So, usually 30 minutes to an hour, it'll usually kick in. If you eat a fatty meal with it, this is the big sort of take home you have to remember. If you eat it with a fatty meal, it's going to get delayed. Everything's going to get delayed about an hour. So if you go on a nice dinner, right, and a nice dinner date, and you're like, hey, we're going to go home, we're going to have sex, and you got steak, you got bread, you got cheesecake, you got all that, it's going to take a lot longer to kick in. So just FYI about that. Fatty meals increase the time that this kicks in. Let's see here. Usually this medication wears off in about 2 to 4 hours if you're taking it for erectile dysfunction. For PAD, it generally is about less than 8 hours. It'll kind of wear off by then. Renal, liver issues, you don't really have to worry about that with this medication. Let's see here. There are off-label uses for this medication. It's kind of weird. I mean, for things like anal fissures, if you have really bad hemorrhoid problems. Esophageal motility disorders, it's used for that as well, but I've never really seen it in practice. It's just whatever I see in literature telling me that, hey, off-label, you can use it for that. I'm going to put up a list of side effects here. The big ones to kind of watch out for is like headache, visual issues, trouble seeing, breathing issues. Anytime you mess with blood pressure, you're going to get anything that could be a blood pressure related issue. People with high blood pressure, you have to watch out taking this medication because you're probably on other medications for blood pressure, and so you might stack them, might lead to trouble there. So you make sure your doctor's in on the loop with it, because a lot of people go see like genitourinary doctors about this medication, but their PCP has them on lisinopril, valsartan, so something for blood pressure, and this and that together may cause issues. I think that's it, guys. Other than that, I think we are good. I think that was pretty straightforward. It's not that complicated of a drug. You don't see too many side effects. If you guys have any concerns, comments, leave them down below. Let us know how we're doing. Hit subscribe to the channel. And if there's any drugs you guys want us to cover, we'll cover them. Let us know. Thanks, guys. See you next time on Meds Made Easy.